we're going to go over our neuropathy spa kit, our home kit for your use at home, and how to get relief from your neuropathy using the home kit that we have, which we've got a whole bundle here, and we're going to go over each of the devices and how to properly use them. My name is Dr. Eric Broadworth. I am the CEO and physical therapist at Fuel Health and Wellness in Grand Rapids, Michigan. And we're gonna get right into it. So this home kit, this is what we use and recommend to all of our patients that are dealing with neuropathy. So that burning in your feet, in your hands, and it can be pretty awful and pretty limiting. This can help with that, and you need to make sure that you're using your home kit every day. So a couple things that we've got here. We've got the Nerve Rebuilder formula. This is just a supplement for neuropathy. Now, when it comes to any type of supplement, we do recommend checking with your physician first before taking this, just to make sure that it doesn't interact negatively with any medications that you may be on. But taking this as recommended, it is on the bottle, so a serving size is 2 capsules, and you take that daily. So as long as, again, make sure that your physician gives you the okay to take this supplement. The next thing that we have is a nerve and neuropathy cream. This is if you've got that burning pain and you're having a tough time falling asleep. This will help with short-term pain relief. So I typically recommend using this cream. You can rub it anywhere that you've got your neuropathy, whether it's your feet or your hands. Rub it in as needed. You can apply it 1 to 2 times a day. I usually recommend putting this on after you use your the Nerve Spa kit with the foot bath or the hand bath if you do have hand problems. So we'll go to that next. So this guy right here, the Nerve Spa, this is, I'm gonna open it up for you and show you kind of what you're looking at and what you're working with. You are gonna do this daily, and so your kit, it's all very self-explanatory, which is nice. The directions are right in it. So I'm sorry for the clunking, but here is this plastic tub where you're gonna fill it with water, okay? And in your kit, you're going to get the Epsom salt, all right? As well as you're also gonna get these foot bath effervescent tablets. So with this, there should be enough really for 13 weeks worth. And you have this in there as well. This is a TENS unit, and here you've got the pads, you've got the blue device, okay? And you've got a charger in there, so you can charge the electric stimulation unit, okay? And in here, there is a nice set of directions. So you're just gonna open that up and make sure that you charge the battery before using. So if you go to right to page 9, that's gonna tell you right there, but you want to plug it in and charge it before using. You're gonna insert the lead wire plugs into the bottom of the device. So in the bottom of this blue device, okay, right on the bottom here, is where you are going to put the lead wires. And so next you're going to connect the pin side of the lead wires to these 2-inch round carbon rubber electrodes. So these electrodes, which are gonna go into the foot bath, okay? You wanna fill the foot bath with warm water and add a teaspoon of the Epsom salt, or sorry, tablespoon of the salt to each bay. So you're gonna put it in both of these bays here. And then you're going to put the electrodes into one in the left bay and one into the right bay. So you're gonna have one electrode in the left, one electrode in the right. It does not have to touch the feet, but they can, that's fine. The important part is that they are in the water, okay? You're also going to put one of the effervescent tablets into the water. So these guys here, you're gonna put one into each side. Just as directed, okay? That's right on the right in the directions here. And you want to make sure, obviously, that this is on. And you really want to turn this intensity up for the electric stimulation. You should feel that electric stimulation. And you want to turn it up so it's tolerable. And it's really going to cycle through, and they do a great job of explaining this in your booklet here of what to expect. So if you pause it, which you can, it's going to go down to 0 and you won't have any stimulation. So make sure you're feeling that and turn it up to a part where you can feel it. There are 3 different programs, A, B, and C. Program A is going to be 4 minutes long, then it goes into program B, which is 13 minutes, and then into program C, which is also 13 minutes. So it's a total of 30 minutes of treatment. So you can do this while you're watching TV, doing some, maybe work at a computer. Just make sure, obviously, that you can sit there for that long, that 30 minutes. That is that for the nerve spot. I recommend doing that daily, and really you could do it 1 to 2 times a day. Now, when it comes to this, if you have a tough time sleeping because of the pain in your feet, I recommend doing this at night. So for those who have a tough time at night, do this at night. If you're worse off in the morning, do it in the morning. That's fine. So that is how that is intended. And again, you have the directions here. I recommend looking through these directions. If you have any questions, you can always ask me as well. But it's pretty thorough right there for the nerve spot. All right. So next are 2 devices that are awesome and really going to give more long-term relief versus the short-term relief. And this is the LED therapy, the red light therapy, as well as the cold laser. So we're going to go over both of those. So the directions again are in these. We're going to go over the red light therapy device first. So this should not cause any burns or anything like that first off. So you want to read the instructions, avoid any burns. It should not get so hot that it burns your skin. If you feel that it gets too hot, you need to take it off. If you do have decreased sensitivity to your feet, I recommend checking your feet 5 to 10 minutes into the treatment, so that way you can see, is it getting too red or anything like that? It should not. And you don't want to wrap it too tight. You want it to be a little loose. So the key with this, you don't want this over any clothes. You want it to be directly on the skin in order to get the proper treatment. But here it is. So you want these lights on the skin, not this part. You want the lights on the skin on what we're treating, okay? So when you put it on your foot, if you watch me here, or say your hand, you're gonna say take your hand and you're gonna put it right here and you're gonna go over like that. We wanna get as much skin on the lights as possible, okay? And so, again, going over, over this, again, checking the skin is important if you have decreased sensitivity. You're going to connect this to an outlet, so there is a plug and everything like that in here. There's also a little strap so you can attach it to your foot and up the foot, so up the shin bone if you need to. All right. You want to make sure that this is plugged in. Okay, here's the plug. It plugs right into the lights. Yeah, so that is the light therapy device. And you've got this here. This is another part of the plug, the adapter. Should be pretty self-explanatory when it comes to that. And then, yes, so you're gonna do this twice a day. You wanna avoid treating any areas with black or brown blemishes, any moles, anything like that. Try to avoid that. Let's see here. So the one side is kind of the important side. The other side is the instructions. And again, you have to plug it in to use it, plug it in the wall. You can use 2 at the same time. So if you wanted a second unit, we can get that to you. Your kit typically only comes with 1. And the green light is going to indicate that the red lights are on. You should also see that the red lights are on. You should be able to see that, but there's a green light indicating that. You press it again, and the blue light, there will be a blue LED light that indicates that the red and infrared lights are on. You want that blue light on, so you want both the red and the infrared in order to get the pain management and the healing to affect those nerves, okay, that we're trying to help with the neuropathy. So we suggest, so it's suggested 20 minutes per treatment area. So if you're treating your hands and your feet, you're gonna do 20 minutes on the hands, 20 minutes on the feet. The more that areas you have to treat, the longer it can take, but that is what's needed. It does have a 20-minute auto shut off. So again, doing this twice a day is what's recommended for best use. I typically recommend like morning and night. Awesome. Next, and again, key instructions right there in the box. Let's go over the cold laser next. So the cold laser is this square little box here, all right? And it's this square little device. Again, the white side is gonna be the back, the black side with the lights, that's what you have to have on the treatment area. So the lights, the LEDs have to be on the treatment area that you're trying to treat. It's gonna be 10 minutes with this. You wanna do this twice a day, so maybe do the red light first, then the cold laser next. And then you wanna take a rest day with this every 5 days of treatment. So if you go Monday through Friday, you're gonna take a rest day Saturday. Then you would go Sunday to Thursday, rest day Friday. So I'd maybe take a calendar and check off what days that you're doing the cold laser, so that way you're getting that rest day every 5 days. This can also help with, on top of peripheral neuropathy, is tendonitis, carpal tunnel, fibromyalgia. So anywhere that you've got some pain and issues, you can put that right over that area. Yeah, that is that. There is a strap in here to strap it. Here's your straps. You can strap this device to your body, so which is what I recommend. Strap it to your feet. When you're treating your feet, make sure you're not up and moving around with it. Have time that you're sitting there, okay? Don't try to necessarily move around with this device. You want to charge it for at least 6 hours before starting it, and there's a plug in there. So make sure you're charging the device, and that is all explained again in the directions there. So that is the cold laser device. I would say the most important part of the treatment, as far as this whole thing goes, is going to be the red light, the cold laser, and then the Quake plate. So if you are, if you have limited time and you can only get to a few things, red light, cold laser are the top two things, and then this Quake plate, okay? So the Quake plate plugs into the wall. You're gonna put your hands or your feet on this, and I recommend 10 to 15 minutes. So there's 15 minutes max, and you turn it up to a level here that is tolerable. So it shouldn't hurt or be intolerable. It should shake you enough that is tolerable, and you wanna be seated when you're doing it, okay? Don't stand on it, sit down when you're doing it. What that's gonna do, that vibration is gonna help wake up those nerves, okay? So that is the kit, the home kit for the neuropathy program that we recommend here at Fuel. If you have any questions, please don't hesitate to reach out to us. You can call or text us at 616-757-0932, or when you come in for your appointment. You can also, if this is video, if you're watching it on YouTube, you can put a comment in the comments below or send us an email. You can email me directly, Eric, E-R-I-C, at fuelphysicaltherapy.com. That is all of that goes for the home kit though. So enjoy. We look forward to working with you and helping you get over this neuropathy that can be so irritating, but we are helping so many people out there manage and get back to active, healthy, pain-free lives. Thanks.